Well, thank you. It's my honor to be here. And also thank you for inviting me. Well, today I'm going to present a joint work with my two courses, Yi from Tsinghua University and Jianguo from Renmin University of China. Well, because usually this is the sleeping time for me. So I feel like I'm have quite slow reaction. So forgive me if I um, cannot respond quickly. So, and also I bring the paper with me so that I can check some details if I cannot recall. Okay, so let's start with the motivation. Well, in many healthcare systems, patients fail such a nonlinear crisis. For instance, their coinsurance rate might change sharply at a given threshold if their annual expenses crosses this given threshold. And then the question here is, can we identify the causal impacts of a Kink increase in such marginal coinsurance rate on healthcare utilization or other outcome of interest when the spending itself is endogenous and can be fully manipulated? So this identification is quite difficult when we have when we do not have enough variation in the policy or when we do not have panel data. Um, well, if we just rely on cross-sectional data and use the RKD or RDD, but when the spending itself, this policy assignment variable can be fully manipulated. So the key identifying assumption in RKD or RDD also fails. So then so the challenging here is how can we move from, well, the traditional bunching studies only identifies the response elasticity, identifies all the response of the manipulated variable itself, but not the effects on other outcomes. So here we try to kind of move from this response of the assignment variable to the causal effects on other outcomes of interest. So that is kind of this paper. So to explore these issues, we rely on this nonlinear cost sharing scheme under China's basic health insurance, where the marginal coinsurance rate jumps at a given annual spending threshold. Then we develop a framework for causal inference under this Kink bunching setting. The basic idea is to use the bunching and the shifting behavior to recover the counterfactual spending distribution and also to recover the kind of the choice to outcome mapping. And then we identify the treatment effects of this nonlinear the introduction of a nonlinear coinsurance rate policy on other outcomes. Here we look at the utilization of outpatient visits. So broadly, this paper shows how to move from the bunching in the assignment variable to a policy evaluation on other outcomes. Preview findings. So methodologically, we provide such framework to recover this counterfactual choice to outcome mapping and identify the treatment effects separately for bunchers and shifters. Shifters here, I mean, those agents with interior response, they change the choice variable, the location of the choice variable in response to, for instance, higher marginal coinsurance rate, but they did not bunch to the threshold point. So those, we call them the shifters. And we estimate the standing response, and we find a sharp, quite sharp policy-induced bunching at the threshold point, and also the marginal bunches response is about 66%. And we also identify the impacts of this policy on the utilization. And in response to a higher marginal coinsurance rate, the outpatient visit reduced by around 88% relative to the counterfactual mean. And given our estimates, we can also conduct some policy counterfactuals. So some background information on China's health insurance system. So primarily, we have two schemes matters here, one for the urban employees and one for the rest of the population, rural residents and also the urban non-workers. So we focus on second type because the cost sharing scheme is simpler compared with the former one for the urban employees. And also, for the urban employee health insurance, the threshold for the maximum amount payable, this annual maximum amount payable, would be much higher. So actually, we use the first scheme as a kind of placebo scheme or the placebo group. So these two figures shows the cost sharing scheme. The left-hand side, we have the horizontal axis here shows the annual expenses, annual eligible spending. Eligible means, the spending should be belongs to the health insurance catalog, and also the deductibles are subtracted. Okay, so this is the eligible expenses for the health insurance. And we calculate the annual amount, cumulated annual amount. And then the benefit here, that is when this annual amount falls below the given threshold, then this is the coinsurance rate is tau. And then when the total spending is above this threshold, the patients have to pay all the expenditure. So here we have slope 0 here. Then the right-hand side figure shows the out-of-pocket with respect to this annual eligible spending. Okay. Yeah. In the US is the opposite, am I correct? Yes, yes. Okay, I'm not yes, so that is kind of a big difference here. Okay, but this kind of limit of the reimbursement also, we can find such a threshold in some, kind of supplementary health insurance, many supplementary health insurance schemes. Okay. So our data, we use the administrative outpatient claim data from one prefecture in the Eastern China. So in total, we have 19 million visits in the year of 2011 and 21 million in the year of 2012, 2 years of data. We aggregate the visit level claims to the patient level because this policy, this annual amount payable is at the annual level. Okay. So an important feature here is that the threshold for the reimbursement switches from 600 to 800 RMB. So a very small number. So, and also, this is the administrative claim data. So the measurement error would be quite low. So that is a very important feature here. And then this figure shows the raw distribution of the annual expenses. And at this, so the green lines are from 2011 with the threshold at 600. Blue lines, we have the threshold 800. So we can find that there's a sharp and a clear bunching at the given thresholds. And also the bunching moves exactly with the policy. Then this is the raw plots of the utilization. So which is measured by number of visits, the total number of visits. This shows the relationship between the utilization and this assignment variable, the annual expenses. Still, at these two policy thresholds, we can find that there's a sharp change in the outcome. So this annual outpatient visits, to the left-hand side of the threshold, these annual visits raise with the spending, but right at the cutoff point we can find quite sharp for. Also, placebo test or the comparison, we can find that for the urban residents health, for the health insurance for the urban employees, we do not find any bunching at 600 or 800. Also, there's no changes in the outcome, the outpatient utilization. So these three figures kind of lending support to the policy-driven pattern we saw in previous slides. Okay, then estimation framework. So we try to estimate the impacts of this nonlinear coinsurance policy on this outcome, the utilization, number of visits. So basic setup, this is the annual outpatient spending assignment variable. Why is our outcome, the outpatient utilization, is the limit here. So this is nonlinear policy. And we define the counterfactual state, that is the linear policy. There's no limit reimbursement schedule. And we have a linear coinsurance rate tau here. Okay, so the low coinsurance rate applies throughout. And under a simple assumption here, so this assumption says that, well, the Asians' optimal choice can be described or is determined by the marginal price and also the agent heterogeneity, these two parameters. And we assume that the effects of these two, the price and also the heterogeneity, are separable. This is not a so strong assumption and can be satisfied in most of the utility. Actually, this assumption means that there's a kind of a rank reserving response. So the change in the marginal price rescales the spending choice without reordering those patients. And in those conventional bunching studies, we also have this assumption satisfied. Then we look at our patients. We can group the patients into three groups here, unaffected patients. So for those with, maybe I can show this graph here. Unaffected Asians or patients, their original spending would be below the threshold, or without the policy, their original spending would be below the threshold. So the introduction of the nonlinear policy will not change the marginal price for them. So there's no location change. There's no change in the choice variable. We call them as the unaffected agents. And then we have the bunching agents. And we have the shifters. The shifters means they reduce their spending in response to a higher coinsurance rate, but they did not jump to the threshold. Okay, so this behavioral response can be captured by an interior shift of the density curve here. And given this separability assumption, a key feature here is that, well, the original location and the new location of the bunching agents can be described by a constant share. So we can derive this important feature using the marginal bunchers. So the marginal buncher is actually the marginal shifter. And we have the location under the Kink policy, the location under the linear policy. And we take a ratio, given the separability assumption, then this part can be canceled out. We have these results. For all the shifters, we can find that the original location, new location, they shift by a constant share, not by a constant, but by a constant share, okay? So this important feature actually give us the idea to recover the counterfactual choice density, this density distribution. So Well, you can start from an initial guess of this delta Z star, which is the response by the marginal puncture. And then given this initial guess of delta Z star, and we can relocate each shifter to their original location, and then combined with the unaffected agents to the left-hand side of this threshold, you can fit a polynomial to the observed distribution and also the relocated distribution for the shifters and extrapolate to the bunching area. And then you obtain a kind of a counterfactual density distribution. And you can calculate the excess mass at the threshold. And also, since the bunching individuals are coming from this region, the region under the counterfactual density curve and between this area, okay? So we can compare the excess mass calculated at Z star and also the area here. So if these two are not equal, we update the value of delta Z star. Okay, and then we estimate the counterfactual density and until we get a equal mass here. So, but of course we need functional form assumption here. We assume that the counterfactual density distribution under the linear policy is smooth near the cutoff point, and that is given by a functional form. We have this non-identification problem, but here we kind of make use of the placebo group to discipline and validate our functional form assumption to support the point estimation. Okay, then we look at the choice to outcome mapping. How can we recover the choice to outcome mapping, this counterfactual mapping under the linear policy? So the idea is that after we estimated delta Z star, the marginal buncher's response, we can relocate each shifter to their original location. So we do this step. Well, in this graph, the blue solid line shows the observed mapping from choice variable to outcome variable. And to the left-hand side of the cutoff, we have those shifters. Then given the estimated delta Z star, we relocate each shifter to their original location. So we do this relocation along this x-axis. We do not change their outcome value, just relocate those each shifter to the right-hand side by a constant shell, okay? Move back to the original location. This would give us this green dotted line. This green dotted line, that is not the counterfactual choice to outcome mapping for the shifters, but the green dotted line and the counterfactual one, the gap here, the gap is generated by the nonlinear policy. So now let's think of this nonlinear policy, the impacts of this nonlinear policy, introduction of a nonlinear coinsurance rate on the shifters. There are two possible effects here, or two channels here. One is the direct spending adjustment channel. So because the shifters, in response to a higher price, they would reduce the annual spending from their original location to the new location. And this shift or this change in annual spending would affect the outcome directly, okay? So these impacts is captured by a parameter mu here. So mu we define as this one, the change in the outcome over the relative change in the annual spending. And then because for all shifters, the movement can be captured by a constant shell, then we can derive that when this mu, this channel impacts is constant, is homogeneous for all the shifters, then the channel impacts here from this direct spending adjustment channel actually can be captured by level shift. So yes.
Go back. Yeah, great. Fine. Thanks so much. I love your graphs. Graphs are so fun. I was trying to think from this graph, and I think you answered it on the next slide. So I just want to double check that my understanding is correct. Your green dotted line, is that parallel to the blue shifted blue dashed line?
No, not parallel.
Not parallel.
Mm.
Okay, so if you go to the next slide, because the intercept level shift confused me because I thought maybe that would be telling me that those were going to be parallel, and then that they're not because I think of your assumption on mu, but I don't know where that comes from exactly. But is that what's driving the non-parallelness? That's totally a word of those lines.
Not exactly. Well, if there are heterogeneity in mu, then the intercept shift or the level shift would be different for all those shifters. But still, that is a level shift, a parallel level shift, given this constant shell. Okay, given this constant shell. Oh, sorry. No, we need this assumption here. We need this homogeneous mu assumption here. Okay. When mu is homogeneous, we have this constant shift, and when there's a heterogeneity in mu, we can estimate the average treatment effects at the average level, at the average response level. There might be aggregation bias, and later on, we can derive the magnitude of this aggregation bias and discuss some scenarios how those aggregation bias, the magnitude can be influenced by some factors here. For instance, it depends on the slope of this curve, the slope of the counterfactual outcome curve. I think I can discuss the heterogeneity later. Okay.
Because my question, I think, is related. Can you go back to the assumption that actually yields all of that, which I think is the one on F? Isn't that you? I think you have to go back there. No, I think there. So F is a density, right?
Which F?
Yeah, there. What is the nature of F? Because you have some form of homogeneity. So the only difference between the two there is that you have the tau and the one. Two functions, right?
Well, one here because in our example, in our application example, the higher coinsurance rate, this higher coinsurance rate equals 1. So in the general case, this should be tau plus delta tau.
Okay. Tau plus delta tau. And then I'm having difficulty understanding the relationship between the two. So when you say like the marginal bunch is satisfied, and then that condition there that you have a, so I would like to understand what is, I'm not understanding what that implies. See what I mean? Like I'm not saying, I'm not understanding like what economically are you assuming right there?
Oh, this is the Kink policy, the optimal choice under Kink policy.
Yeah, and then the other one is the optimal choice under the
counterfactual linear
counterfactual policy. Yeah. So Enrique, I was thinking something something else, which is I'm not understanding. So can you give me an example of a function f or something like that that would satisfy this, and then so we know what is like the
So
economics
this
of
is
it.
the first. This is the Kink policy, and this is the counterfactual choice. So f is just this part n here, function of n. Yeah. Okay. So this is the first channel from the direct spending adjustment, and then the introduction of the nonlinear policy also changed the out-of-pocket burden for the shifting agents. Okay, so now we have the out-of-pocket on the counterfactual policy, Kink policy, and we can calculate the change in out-of-pocket. And still, we define this parameter lambda here, which captures the second channel, the out-of-pocket channel impacts of change in T on the change in outcome Y. Then still we assume a homogeneous parameter here. Then this out-of-pocket channel contribute or can be captured by a slope change and an intercept change. Okay, so we combine these two channels together and assume these impacts from these two channels are addictive. It's just like the channel or mechanism analysis in many quasi-experimental design. So you have different channels, and then the channel impacts can be addicted. So then under this assumption, the gap between, we go back to this graph here. So the gap between the relocated outcome and the counterfactual outcome, this gap actually can be captured by a level change and a slope change. Okay, so we have this result here. And the relocated and counterfactual outcome involves a level change and a slope change. This is the estimation restriction that leads directly to the outcome regression in our empirical implementation. To recover the full tries to outcome mapping, we still make the functional form assumption for outcome Y. And then treatment effects for shifters, we can define the treatment effects for shifters and for bunchers separately. So basically that is we have the average outcome on the Kink policy. So that is the average treated outcome for shifters, average counterfactual outcome. Under the linear policy for shifters, the difference is the AT for shifters. Bunchers, similarly, we have average treated outcome, average counterfactual outcome. Okay, so to calculate the average treatment effects, the key step is to recover the counterfactual density distribution and also the counterfactual choice to outcome mapping. Okay, so our estimation steps, we recover the counterfactual outcome counterfactual density distribution together with the marginal bunchers adjustment. And then we relocate all the shifters back to their original location. And for the outcome set, we estimate the counterfactual outcome schedule using the relocated shifters together with the unaffected agents. And then we calculate the treatment effects, obtain the standard error by bootstrapping. After we obtain all the estimators, we can evaluate alternative coinsurance, cost sharing plans. Okay, so this is the regression equation for outcome variable. So we have polynomials, yj right here on the to the left-hand side of the threshold, we have the unaffected agents. So this outcome Y using in the regression is the observed outcome value. To the right-hand side of the bunching region, we have the shifting agents. So the regression outcome value, that is the relocated value. Okay, relocated value. And we put this is an indicator for the right-hand side of the threshold, and also the interaction between this indicator and the assignment variable. So basically, beta 0, beta 1 captures the level change and the slope change at the cutoff point. Estimation is conducted using the binned value, also excluding this bunching region. We have the polynomial order here. We manually determine the polynomial order for the density estimation and outcome estimation, and then we conduct the robustness checks on the choice of the polynomial orders. And also the diffuse region is also visually determined, and also we conduct robustness checks on the choices of diffuse region. So after we obtain this beta 0 and beta 1, these two coefficients can be mapped back to the structural parameter mu and lambda here. So mu captures the channel 1, the direct response shifting impacts the change of Z on outcome Y. And lambda here is channel 2 out-of-pocket channel, the change in out-of-pocket on outcome Y. Okay, so then these two structural parameters can serve as sufficient statistics for policy counterfactuals. Calculation of average outcome for shifters and for bunchers. Shifters, that is easier because we have kind of one-to-one mapping between the treated location and the counterfactual location. So we can have, also we have their relocated treated outcome and the counterfactual outcome for each shifter. So we can actually calculate the treatment effects for each shifter. But here we do an aggregation. Okay, so we use the distribution as a weight and calculate the average outcome, average policy effects for the shifters. Bunchers, that is a little bit complicated because we do not have a one-to-one mapping in terms of the location. So we treat the bunchers as a group and calculate the average policy impacts for this group. So basically that is also, we calculate the treated mean for the bunchers and the counterfactual mean for the bunchers. So after we recover this counterfactual density distribution and the counterfactual tries to mapping, then we can recover these two values. So basically the observed point, the observed bunching point, or the observed outcome for the at the cutoff, if we have a sharp bunching, the observed outcome here, that is a mixture of two groups. Yeah, 5 minutes. Okay. So in the observed state, the bunching region at the threshold, that is a combination of two groups of individual bunchers and unaffected agents. So their observed outcome is a weighted average of these two groups. So after we recover the counterfactual mapping, we can back out the treated mean for the bunchers and also counterfactual mean. Diffuse bunching, the only difference is that the mixture is not at one point, it is at a region around the threshold, okay? Then our results here, this is the observed density distribution is displayed in the green line here. And the red line, red dashed line is our estimated counterfactual density distribution. Blue dotted line here, that is the relocated position for the shifters, okay? we do a comparison using Chetty's method to recover the counterfactual density distribution. The only difference is that in Chetty's method, they assume a parallel shift for those interior response agents. So, but in our approach, we relax this assumption because we use this constant shell relationship to relocate each shifter back. And this is this shifting is not a parallel shift. Yes.
Did you try to also run Marino's and Nathan's estimator, like the Tobit, for instance?
No, but maybe we can have a try. Mm. So this graph shows the observed and the counterfactual tries to outcome mapping. Then still the green dots here are the observed values, and we have the counterfactual curve here. The estimating results. So this is the adjustment by the marginal puncture, the constant shift, that is 1.6. Average treatment effects for shifting patients, that is -2 or -2, which means the introduction of nonlinear policy would reduce the outpatient visits by 2 annually, correspond to 88% reduction. And for bunching patients, the impacts would be relatively smaller. Robustness checks, policy counterfactuals. So using the estimated those parameters, response elasticity and mu and lambda, we can experiment some alternative policies. For instance, we change the cutoff, the threshold values, but we keep increase in the marginal coinsurance rate at the threshold constant. So we can find that the total expenses and also the total reimbursement values would increase when we are facing higher thresholds. And we can also experiment, well, for instance, lower cutoff, but with a higher jump of the marginal rate at the threshold, or higher threshold with a lower jump. Some validity checks for the functional form assumption, because we have placebo group, so we can plot their placebo distribution and verify those kind of, it's like the parallel chains idea, okay, to verify the functional form assumption. Okay. Heterogeneity, well, put it in a simpler way. So we allow for heterogeneity. In this case, we can estimate the response at aggregate level. Okay, aggregate level, and this would introduce aggregation bias, and this bias would be small if the counterfactual density would be flat. Counterfactual density would be flat, or the counterfactual outcome, this outcome mapping would be flat. And also when the heterogeneity is limited, or the heterogeneity subgroups have similar response patterns. Okay, so that is, yeah, I think I can stop here.
Anyone have any questions?
Huixia, can you go to the plot, the main plot, the one you showed 1,000 times, the one that is like the awesome one? Keep going back, but I think you did pass one of them. But I actually, yeah, right there. No, one more. I think this is the one, right? So there's one interesting, actually, no, go back. I think the one where it shows a lot better is, I think, on the estimation. No, keep going back a little more, well, no, back. I think it's in the framework then. Back.
Okay.
I don't know. So it's the one that you have actually the data points, and then you have that situation, but you're showing like what's happening before, but not the theoretical, the actual empirical one. I think you probably passed, and I missed it.
Well,
Yeah, there's probably one in the result. There, I think
here.
this is the one. Yeah.
Yes.
Sorry, yeah, I made you like go back. So because it is my impression that there's something special about your application in which in both years, the way that people are reacting to the, the original one when you have the marginal rate that happens for everybody, the one that didn't change, also doesn't change. So there seems to be like no trend of any kind, no economic shock, nothing going on in between the 2 years. And so so first, if you can confirm to me that that's true. So basically you have through both years, the way the people are acting up and exactly. So they're basically doing the same thing all the way up to then you hit the threshold, you don't hit the threshold. Yeah. So what I wanted to ask you is, how important is this for your application? So the fact that you do have, in some sense, a somewhat of a quasi-experiment to a big degree there, where you have the entire, unaffected area also not changing, because the normal thing would be for you to have perhaps some economic shock or some changes in which, it will vary a little more.
Well, actually, we do not need the exact overlapping of these curves for the unaffected agents here.
And where does it show up then? So we say, okay, we don't need that. The fact that the overlap is not really what matters, but you are calculating, those vertical distances and things like that based on something. So based on the fact that basically would start in a certain place. You see what I mean? Like in the sense that if it's not, then how are you accounting for that? You see what I mean? That when you're using the information from the previous year, let's just say. Because you are using, right, unless I'm mistaken, you are using the observations of both years, let's just say, to calculate your all the things you calculate, because there are several.
Actually, no.
Oh, you just use the
use
second.
1 year data, and then we can recover this counterfactual.
So you do it exactly with a single year. So you just do it with the second year.
Second year
With
is
whatever the year that they apply the change.
validate the functional phone restriction here.
I see. Okay, so then I misunderstood something. But then I'm also, why then don't you, as an empirical person, then why wouldn't you use them though, the one that you do have? Go back to the previous plot that you had, the empirical one? That one, yes. What, are you telling me that you're not using the blue information at all for the estimation?
We can use it as an alternative approach to.
Oh, that's my question. Okay, yes. So you
Yes,
could
we
use it
can.
because this is almost like a it looks pretty convincing as a, some form of different diff possibility or something like that. Yeah.
Yes.
You mean the blue part in between 600 and 800 as a counterfactual for what would have been the green part
Yes.
during that period?
The
Yes.
free trend, if in a sense.
Yes.
Yeah. So so like what you're saying is what I think like they call the control group method, right? And so yeah. So like you could use so I think you're getting kind of good comments from people. If I can try to speak, comparing the different counterfactual estimations would be really interesting in your setting. You have really sharp bunching, which is nice, right? Stefan's question about like, well, you could try to see what the Tobit says, but you can plot totally what the Tobit says. You can plot exactly what Chetty says. You can plot exactly what the control method would say. And then you can plot what you have. And it'd be really great to just look at all those different counterfactuals, because that's what's driving any differences in the estimation. So being able to compare would be great.
I see. That's a good idea.
And then I think the thing that I'm most interested in is I think what's going on is you have to put some structure on estimating the counterfactual, right? Or you have to have more data, right? So the control group method has more data. The Tobit has more structure. Your structure is kind of fun, which is you're adding structure to how you assume the treatment effect is proportional, right? That's the assumption that's allowing you, that's the additional structure that's allowing you to estimate that counterfactual.
Yes.
And so I don't immediately see how that compares to the other ones in terms of like when will they be more different and when will they be more similar. Here they might be very similar, but I'd be really curious as to when, if you have ideas of when you think they would be very different.
I think we're a little bit out of time, so
Okay.
maybe we can talk
Yeah, we
afterwards.
can talk
Sounds good.
during
Thank you.
the